Hello everyone, my name is Lakey Rutherford, and for some of you, welcome back to my speeches. Today I'd like to discuss with you a little bit about some information regarding a disease that many Americans are facing. As of 2010, this disease had affected 615,000 Americans, and each year 45,000 new cases are actually diagnosed. With those statistics in mind, I'd also like to share a quote I ran across during researching this information. It stated that nothing in our bodies is affected without a cause, and that cause has an effect. So therefore today I would like to share the effects of Meniere's disease in hopes that it may help someone going through these symptoms and help them find early treatment as well as a diagnosis. Meniere's disease was actually named in 1861 by Prosper Meniere, a French physician who acknowledged the abnormality of the inner ear to deal with fluid balances that could affect an individual's normal balance and also hearing functions. The severity of the symptoms can be lead an individual unable to function in everyday routines, as well as cause them to have permanent hearing loss. This illness is actually said to affect individuals in their 40s to 60s, but also can affect children, according to the Mayo Clinic. Although this disease is not fully understood, the effects of the abnormal buildup can interfere with the normal balance and hearing signals between the inner ear and the brain. Today I'd like to focus on recommendations for this illness. Those recommendations would be to acknowledge symptoms early, seek an ear, nose, and throat physician, as well as adjust dietary, take proper medications, therapies, injections, and surgeries. First of all, I'd like to start with acknowledging symptoms early. The presence of 2 or more episodes of symptoms lasting at least 20 minutes should be evaluated by a physician according to Mayo Clinic. Those symptoms present as vertigo, dizziness, a roaring of the ears, fluctuating of hearing loss, pressure, pain, and fullness in the affected ear or maybe both ears, as well as nausea and vomiting are symptoms that can be presented. Once symptoms have been suspected, a physician should be contacted. Typically that would be an ENT physician, known as an ear, nose, and throat. That way the proper testings can be provided as well as treatments for patients. According to Mayo Clinic, several assessments are recommended, those being a VNG testing. That is a video that actually watches the stability of an individual's eye muscles as the head adjusts around, the eyes actually stay fixed to a spot, and that allows them to see the balance issues of the individual. The next would be a rotary chair testing. This actually evaluates the level of stability and measurements of eye movement as well as the balance and function in a environment. This is all actually maintained through a computerized system to evaluate the patient's different levels. The third would be a VEMP test. This is known as a measurement test to test the sensors of the inner ear canal. This actually detects movement as well as sound and causes muscles to contract around the neck and eye when they're being when they're being triggered. The next 2 common tests that will be seen, suggested also as from Mayo Clinic, would be an MRI and a CT scan. From those of you that have actually already been introduced to me, I am a MRI and CT technologist who actually see many patients going through these symptoms and help them with their tests on a day-to-day basis. An MRI machine actually allows us to visualize a 3D image of the inner ear canal, as well as evaluate the fluid and pressure levels, as well as chemical compositions within the inner ear canal. The next test is the CT scan. That actually allows us to provide axial images of the IEC and evaluate the fluid buildup as well. CT is often done in an axial image that would be more of a top to bottom of the brain. That would allow you to see sharper bony structures. Sometimes bone structure can actually stricture the fluid in the inner ear canal, so sometimes that will allow them to see if it's a bone or if it's just a inner ear composition problem throughout the 3D images that can be provided either through CT or MRI. Next, after being diagnosed with Meniere's disease, educational packets as well as adjustments should be provided. First, recommendations are usually an adjustment with dietary. The first would be to lower sodium diet. A Livestrong website actually presented that reducing salt or sodium intake is a core component of Meniere's disease treatment. The next would be to decrease consumption of caffeinated items such as coffee, tea, soda, and unfortunately chocolate. It states that by lowering these items, you can actually lower the blood level concentrations that affect the concentration of the inner ear so that there is no overload. This information was actually confirmed in an article found by Dr. Stephen Roch, as he stated these adjustments can cause a sizable shift of fluids in the inner ear canal and will give relief. Furthermore, another quote given by Dr. Timothy C. Hahn stated that the goal of treatment for Meniere's disease is actually to stabilize the bodily fluids and blood levels so that secondary fluctuations in the inner ear can be avoided. Another option that many individuals may choose to decide would be to take medication as needed. Physicians actually should begin with motion sickness or nausea medications. This is assessed by the Mayo Clinic as well. Often Valium for dizziness and promethazine for nausea is recommended. However, long-term treatments recommended by the Mayo Clinic are diuretics. Diuretics actually can help with fluid retention, and they can help an individual gain control over fluids, such as volumes or pressures within the inner ear. This actually will help them regulate and maintain their attacks on a day-to-day basis. However, if adjustments with diet and medication are not enough treatment for some individuals, therapies, injections, and surgeries are actually other options that an individual can pursue. According to the Mayo Clinic, hearing aids and Minute devices are actually two therapies that are utilized for Meniere's disease. Hearing aids are usually assessed by an audiologist, and Minute devices are actually, it's a type of pulse that allows positive pressure to the middle ear to help improve fluid exchange. So that way fluid doesn't build up, it actually has a sense of flow back and forth. This allows a better ventilation through the canal. Injections are also another treatment option, as they can be administered into the middle ear. Gentamicin is an antibiotic. It's actually toxic to the inner ear, but it does reduce the balancing function of the ear and actually assume responsibility of the balance. So therefore, it may stricture the symptoms that may be occurring that may help the individual maintain normal balance better. Surgery is also the last solution an individual usually decides, mainly because it is the most invasive. But if symptoms become too severe and unbearable, surgery is definitely an option. The first procedure would be the endolymphmatic sac. This procedure actually evaluates symptoms of vertigo and can help alleviate decreasing fluid production or increasing fluid absorption. The second would be to decompress the endolymphmatic sac. This procedure actually takes a small portion of the bone and removes it, and then puts a shunt in to help remove the excessive fluid. The third would be an individual can consider a vestibular nerve resection. This actually cuts the nerve, which allows the balance and movement sensors between the inner ear and brain. Like I said, sometimes surgery is the last resort, but there are relief seen with these type of procedures. Finally, the last would be to have a surgeon remove the balance portion of the inner ear, therefore removing both balance and hearing function from the affected ear. After diagnosing, testing, advising dietary, medication, and treatments, the individual must then decide a plan that works best for them. Although there is no cure for Meniere's, there is simply a relief. I chose this topic today to share a little bit about it with you since I currently have a family member that has experienced Meniere's disease. She has went through several testings, and I must say that as of now, the dietary and medication have seemed to give relief with her symptoms, and I just am very thankful that we were allowed to share this information with others in hopes that their symptoms can be relieved. And I hope that this information has been useful to you, and I hope that an individual that may be going through these type of symptoms, you can pass along to them. Thank you for your time, and God bless.